And hello, hi, welcome along. This is Kathy Fray, and welcome along to this week's IMCO Maternity Natural Health webinar. So this is hosted by IMCO, which is the International Integrative Maternity Healthcare Organisation. And this one is an slightly unusual webinar this week, as it's just me. And usually there would be at least two of us on here with various topics. But yeah, I'm doing a solo performance. So welcome along. And the topic we're going to be talking about today is integrative maternity healthcare. And I'm just going to share my screen with a, here we go. Sorry, let's start recording. I'm just going to share my screen with you with a PowerPoint presentation. Okay, so hopefully, there we go. Aha. So hopefully you're looking at a full screen of the slide. If you're not, for any reason, if you're seeing the other version where there's a big slide and a little slide, feel free to message me and let me know. But otherwise, I'll just assume that it's looking okay. All right, so this is actually a training session that I put together for PESI, and this is a much longer, the PESI version is a much longer, it's about a 2-hour, actually even slightly longer than that, training session, about 2.5-hour training session. So we're going to do a bit of a condensed version here today. So I'm just going to flick through some slides. Okay. Actually, this is kind of interesting, I guess, if we just go back and that, you know, the old, those of you who are healthcare professionals, the old hierarchy of needs, which you're probably already familiar with, and when you sort of throw it on top of the maternity journey, you know, those physiological needs of women, you know, through that maternity journey, the food, water, warmth, rest, you know, those are basic things that women do, you know, see as their fundamental right, and so it should be, a woman who's expecting, etc. And the next level on the hierarchy needs is safety. So that's sort of, you know, the feeling of security, stability, health, etc. And again, you know, we really do see that as a basic entitlement for women who are expecting and women who are in labour, you know, women and their babies in that postpartum period. The next level on the hierarchy of needs is belonging and being loved. You know, that friendship, relationships, inclusion, etc. And, you know, when we see this in the maternity journey, it is often the woman choosing, you know, her health professional and choosing her birth support people, because belonging and being loved is an important part of the journey. And then that second to top section of the hierarchies, the hierarchy of needs, where you were talking about respect and recognition, status, strength, prestige and freedom, etc. Well, again, you know, she will regard that as an expected, you know, part of her journey. And in many countries, it's actually sanctioned in law. That, you know, a pregnant woman, any patient needs to be given respect, etc. And then finally, that self-actualization, which is when, you know, she plans to create and achieve a full fulfillment of her maternal experience. Example is your birth plan. And anyway, we have digressed looking at the summary. Okay, so I'm just going to go through. So firstly, I am integrative medicine. So integrative medicine, what is that? You know, probably most of you will already know that at the moment. You know, it's that modern healing orientated medicine, which takes account of the whole person, you know, including all aspects of lifestyle. And what is perinatal integrative? Well, that's integrative medicine. PIM, also known as integrated maternity healthcare. PIM is simply the perinatal subsection of integrative medicine. Well, we've got a definition here. When the medical and the holistic, the modern and the traditional, the allopathic and the naturopathic all respect how they complement each other to intentionally form a united revolution of cohesive evolution to create the best in maternity healthcare. So yeah, that's a little bit there. Racing through. So these are the 5 traditional, subsections of perinatal integrated medicine. So firstly, you've got traditional medicines. So that's like homeopathy, which we're going to talk about quite a bit today. Homeopathy, medical herbalism, essential oils, traditional Chinese medicine, Indian Ayurvedic medicine, etc. Your next section are those mind-body connections, so things like meditation, spiritual healing, neuro-linguistic programming, music, dance, etc. Then you've got biological nourishment, so things like diet, vitamins, minerals, supplements. And actually it's kind of extraordinary when you think about it that minerals and vitamins are regarded as integrative medicine or complementary medicine. They're not regarded as medical medicine, but I'm like, it's kind of a pretty basic thing that you would think should be part of it. But anyway, body manipulation, so that's chiropractic, osteopathy, kinesiology, and lastly, energy healing, so things like Reiki, Qigong, pulsed electromagnetic fields, sexualities and therapies just kind of cross over into, more than one of those categories as well. And okay, we'll leave that. All right, so let's get to the nitty gritty. So these are the main areas of wellness and wellness within the maternity journey. These are the main therapies, I should say, that we tend to use in that journey. So we'll just run through them. Acupuncture, acupressure, Sebastian. Acupuncture is using needles. Acupressure is not. It's literally just pushing on a spot. And so acupressure is a particularly useful thing for birth support partners to be using as part of supporting their partner who is in labor. It's that's a particularly useful one there, although a lot of these things can be used in a lot of different ways, so it's just really an overview. Ayurvedic medicine, so that's Indian herbalism, or TCM, traditional Chinese medicine, or Western herbal medicine, all medical herb, they're all types of medical herbalism, and a lot of the time when we're giving advice out, particularly on things, the platform like Ask the Maternity Gurus, if you aren't familiar with that, is we will be recommending see a medical herbalist who's a maternity specialist. And it really doesn't matter if it's Indian Ayurvedic or traditional Chinese medicine or Western herbal medicine. All of those very ancient forms of medicinal therapies have got thousands of years behind them of use, and a lot of them have a remedy. There is a remedy within each of those spectrums which will deal with a particular thing. So they all work very, very well, and a lot of times they cross over. So quite often you might have somebody who's trained in traditional Chinese medicine, TCM, but also has a background on Western naturopathy, herbal medicine as well. So those all kind of are very work very well together, and work on their well on their own as well. The Bach flower essences, things like Rescue Remedy would be the most well-known of those generally. So Bach is the name of the man who put them together, and he created a whole lot of flower essences. Unfortunately, he died younger than anticipated, which and really that work has never been carried on in the same way that he did it. So the same essences still are there. So Rescue Remedy is a blend of them. I'm not sure if you've heard of it or not, but it's you can buy it in most health shops and over pharmacy counters and things, but it's a really great little tincture and completely safe through maternity. It just helps to just calm things. Yeah, so it's a wonderful one to be using, not just say for example with the woman during labor, but with the birth support people during labor too. Be great. It's great for everybody. Okay, and great for little and also babies and children. Okay, so just skipping down, homeopathy is, I would say, one of the most valuable things to be using within the journey of the whole maternity spectrum, particularly for expectant mothers during labor. Well, actually, yeah, but homeopathy is fantastic in this space. So certainly one of my favorites there, but we're going to move on. Okay, so overview of PIM use across the maternity journey. So these are the along the timeline when it is very, very useful. So preconception healthcare, absolutely, that micronutrition. We know now, the more we study this, the epigenetics, the more we realize we don't know when there's so much to know. So what we know now and what science will know in 10 years from now or 30 years from now when it comes to preconception healthcare, is just rapidly growing. And the reason that we're learning so much in such a short time is because this is the first time in history often that we've got the medical, the kind of scientific ability to to study something that might have been used for a very long time. Okay, so that's when the old wives' tale gets studied and realize that, oh my God, this has got some really, active ingredients in it that actually do what it's been used for all this time. In general terms, preconception healthcare is something that ideally the female partner would be on for 6 to 12 months before trying to conceive, and the male partner would be on for 3 to 6 months before trying to conceive. Okay, so now as far as some of the a lot more of information on this, all of what we're talking about today is in this book, and way more than that as well. Oh, I'm trying to do that, make that work. No, okay. Yeah, so Oh Mama, which is the perinatal integrate. So it says Oh Mama, perinatal integrative healthcare. It is the birth practitioner guide to holistic maternal neonatal wellness. You can download this off Amazon for not a lot of money, and that would be that's your really comprehensive handbook on all of this. So this is really just a very little overview, but a good introduction. So then we have fertility, subfertility, infertility. So absolutely, perinatal integrative medicine is massively beneficial for that, particularly naturopathy. Pregnancy, the relief of common minor discomforts, and pregnancy support of pathological disease. So there are, basically there's some minor things that are common, and where perinatal integrative medicine can often assist with those symptoms, and then you've got things that and we're going to go through some of these. Then you've got things that are actually more complicated disease of pregnancy, complexities that have come in, and that's where you will nearly always be needing modern medical obstetric science, but also the perinatal integrative medicine can be incredibly supportive, and often help to lessen things or improve things. Okay, so then we've got childbirth preparation. Massive. This is like, and again, we'll talk more about this soon in this session. Incredibly powerful, doing that preparation, particularly for ripening or softening the cervix. Oh, hallelujah. That is the big thing, to make sure from around 35, 36 weeks onwards that the woman is using birth preparation herbal supplements, getting that cervix so soft, so stretchy, so ripe, so ready for when she goes into labor, so that when she is having a strong active labor, the dilatation occurs efficiently, rapidly, just beautifully. And when she has that really productive labor, well, hey presto, it just reduces all the other potential complications of labor when it's drawn out, and you've got epidurals going up and oxytocin drips and all of the huge massive levels of complications that brings in. You're taking a labor from being natural, spontaneous and low risk to high risk. When you start to introduce those things and those cascade of intervention, it's often known as. So, using childbirth preparation at 35 to 36 onwards to soften and ripen that cervix, it's just the benefits are just enormous. Okay, so then we've got normal labor, so meaning the first stage of going from that very first stage of latent labor through strong active labor and right through to advanced traditional labor. And also normal birth and afterbirth. So that is the second stage. So that's the actual birthing of the baby and the birthing of the placenta. But also, PIM can be used for childbirth complexities and obstetric complications of labor and birth. So again, it's a support therapy in that role. And then obviously postpartum maternal well-being and postpartum neonatal well-being. All right. Okay, so we'll just move on from that one. Okay, so simplest basic preconception healthcare. So I'm just going to go through these kind of rapidly, because you've got the you can do a screenshot if you want, particular slides, etc. Okay, so preconception healthcare in the female, as I say, ideally 6 to 12 months. And generally, we're just talking generally here, but it would be much better to have a individual one-on-one consultation, with a qualified trained medical herbalist to have a customized regime. That's always the best, but as a gentle overview, the woman wants to be taking a maternity multi plus some quality non-constipating form of iron, such as spartone. For the male, ideally he needs an antioxidant with zinc and selenium. It's the kind of the two big things, that motility, etc. And for both, as a glandular system boost, maca is a great thing to take as well. Right, so we're moving quickly. Routine health care during pregnancy. So people often are like, what should I be taking through pregnancy? Well, first, number one, a quality maternity daily multi. And that is not necessarily the most well-known one, that's for sure. Okay, so often you'll find that the most well-known maternity multi, wherever you happen to be on the planet, tends to be, it's just well known because it's got the biggest advertising budget, not that it's necessarily the best quality or the best value. It tends to be from pharmaceutical companies who have that big budget for advertising, and they kind of look at a multi and go, oh, that's not a drug, but let's try and make money off that as well. So yeah, I would say in general terms, your better quality ones are the ones that are companies who specialize in naturopathic therapies. But never hesitate to ask at your local health shop, hey, what do you think is the best quality and best value maternity healthcare supplement? So a daily multi is a must. Omega-3 DHA, it's a little oil capsules. Probiotics, got to keep the gut health looking good. And then also calcium, an additional calcium supplement and an additional non-constipating iron supplement. Even when women are taking a daily multi, in my experience, it is rarely enough iron in that pregnancy as the pregnancy continues. When you think that when you take a daily multi, and you're 6 weeks pregnant, your baby is the size of a grain of rice, right? Your nutritional levels at that micronutrient point for that fetus, like what does a grain of rice require? Not a lot. But by the time at the end of your pregnancy, goodness, you've got this big pound baby that's, in a placenta and all the fluid and everything else going on. So it is kind of nuts to think that, one daily is all we need the whole way through in the same level. In a way, it's not. We need extra iron and we need extra calcium, especially in that second and the third trimester. And with the iron, the issue there is that, by the time you get into the third trimester, a woman has got 1.5 times the blood circulating in her body as a non-pregnant her. We often say that in maternity healthcare with perinatal integrative medicine, it's, you're not dealing necessarily with women who are of ill health, but these are not women of their normal health. Pregnant women are not women of normal health. In comparison to the non-pregnant, they have different needs and different things are going on, clearly. But anyway, so you've got by the third trimester, there's 1.5 times a non-pregnant woman's blood circulating, and every single blood cell requires 4 iron molecules, and those 4 iron molecules are actually how oxygen attaches to our hemoglobin and how it travels around the body. So that's why, when women are low, when they have syphilis, because they've got less blood circulating than they need, and their hemoglobin rates start to fall because they don't have enough iron to make it all. So an iron supplement, non-constipating, so that means not one of the really cheap, like horrible prescription little tablets to make your stools go black, not that one, or those. No, you want a good quality one like Spartone sachets. They would be my certainly one of my favorites, Spartone. And then calcium supplements, especially again in that second and third trimester. Babies that, when you've got a woman who's had really generous supplies of calcium going into her body during her pregnancy, it's hard for me to put my finger on it, but their babies are more content after they're born. They just are. So you get these kind of content, easier to settle babies. I can't say that to you scientifically with evidence. It's anecdotal. But also, obviously the calcium needs are massive, and your body will still from you as a pregnant woman to give it to your baby. So it's about making sure the woman is not left, calcium depleted at the end of her pregnancy, which potentially is something she wouldn't even know about, for sometimes decades. Yeah. Okay. So common discomforts of pregnancy that are treatable by perinatal integrative medicine. Okay. Just checking our time. Okay, so yeah, common discomforts. We've got a big long list there, but those are the things that have a read through at some stage. Maybe just take a screenshot of it, and these are the things that can be just so good. So you can just ease those symptoms and potentially cure those symptoms without needing drugs. And yeah, although sometimes some of these are very, actually, I would say, yeah, just looking at that, UTIs, it's a very good idea to be taking antibiotics through that as well. Yeah, there's a lot more detail in the Oh Mama book where we go into each one of these individually. But that's, as I say, a general overview. So if we look specifically as an example of nausea and vomiting, so morning sickness, and this is an example of the sorts of things you'll see in the book. So yeah, so you've got, avoiding, you'll have herbalism nutrition, so avoiding large heavy metals, nibbling on dried fruit, fats and cheese can help to settle the tummy. Drinking freshly made hot cups of honey and lemon, ginger and cardamom, etc. The Schussler tissue salt number 4, very helpful. The Schussler tissue salt combo 5. 4 is ferrous frost, 5 is a combo. They can potentially be helpful, and all of these have are completely safe, to be using. Walking, getting lots of air, if bearable. If it's unbearable and it's persisting into the second trimester, then definitely be seeing a herbalist or naturopath or traditional Chinese medical therapy. Good. The acupressure point number P6, which you could Google, and actually that's the same pressure point is it's in here, and you'll find it as a pressure point on seasickness wristbands, and for years seasickness wristbands with their little pressure point here were purchased by pregnant women because it became known that they were helpful. And I see, in more recent years that those seasickness wristband manufacturers, these days are packaging them up as maternity pregnancy morning sickness bands. I've renamed them, so good on them. Okay, and then there's a whole lot of other potential things here for you as well. So with homeopathy is goodness. I just adore it for the whole maternity journey because it's incredibly safe. And the thing with homeopathy in general is that if you use the right remedy for the right issue that's going on, it will have a positive impact of change and improvement fairly rapidly. You'll see a difference, 15 minutes type of thing. You'll see a difference. If you choose the wrong remedy for that particular condition, you think, oh, I'm not sure if it's this remedy or not, then you'll see no change. That's it. And so often people will be asking, oh, is it safe, to be taking homeopathy through pregnancy? And the homeopathy from a pharmaceutical drug perspective is nothing. It is placebo. There is no molecular structure of a drug or medicine in that tincture. It's a vibrational tincture. So that's where it's completely safe because there's no drug in it. And so it's wonderful in pregnancy, wonderful for birth, wonderful for postpartum, wonderful for babies, wonderful for children, wonderful for everybody. But so when you look at the list here, that's a really good example on morning sickness. You know, all the different remedies and what symbols they can be. And, you know, you might look at this and it's a bit that, and that's that remedy, and that's that remedy. Oh, well, take both. It doesn't matter. You can combine them. So if we kind of look through here, so when somebody has got morning sickness, we're at the sight and smell of food, that will trigger it, or she's feeling particularly lethargic, or she's kind of a bit grumpy at her partner, that's probably sepia. Or when you've got morning sickness, where it's early in the pregnancy with headaches, and there's almost like a feeling like there might be dehydration by sort of a fluid imbalance, well, that's NATMER. Or when there's that feeling that you need fresh air, you're kind of feeling almost faint in a hot room, you know, and it's worse if you're traveling in a car, well, that's probably pulsatilla. So that's where, etc. So as I say, feel free to screenshot that, but it gives you an idea of all those different remedies, and they're fairly inexpensive, the remedies too. Okay. So pregnancy emotions, this is where homeopathy again is, oh my god, it's so great. So, you know, if the woman's feeling general anxiety, you know, go put together a mixture so aconite, gilsylmian, arsenicum, all of those can be useful. Put it all together if you want. If you've only got one of them in the cupboard, use that. You know, if her pregnancy emotions are making her feel very weepy or needy, that would be pulsatilla, etc. So it's about seeing that symptom and knowing which is the best one. Or that's where pregnancy emotions, intense emotion there, that's the Bach's flower essence combo. But you can do them both. You know, you can do homeopathy with Bach's flower essence remedy. None of them are drugs. Okay. Iron-Depletion Anaemia. Yeah, well, we just had a bit of a chat about that. So firstly, taking a superior quality, highly absorbable iron supplement that contains all of the important cofactors to enhance the absorption. So things like spartone, plus the Schussler tissue salt number 4 of ferrous, a spirulina combo that features a rich concentration of nutrients, large dandelion and nettle tea. Now, if that hemoglobin is under 90 and it's not responding to treatment, then definitely be seeking a medical consultation as well. You know, they would to get them, you know, get their system better equipped for that pregnancy. As well as obviously dietary advice, organic supplements, acupuncture and homeopathy consults are very helpful. So under homeopathy, again, this is a complementary thing that you would be taking along with the iron supplements. There's a bunch of them there. Constipation. Yep, so again, we've got a lovely little list there, pretty common things that be going on in pregnancy, and that's because in pregnancy you've got the relaxin hormone in the pregnancy, which is designed to relax, you know, all the connective tissue in the pelvis, with tendons and ligaments in the pelvis, so everything's nice and loose for giving birth. And you've got the relaxin, you've got the hormones of pregnancy, which preventing the womb from contracting. And all of this really sort of ends up impacting on the peristaltic movement of the bowels. And so women do tend to get constipation in pregnancy. So yeah, there's some great remedies that you can take for that. Reducing carbs and reducing refined food is super helpful. Adding in, lemon, ginger, and honey can be helpful. Ginger particularly, it stimulates peristalsis. And an inner health type supplement. Making a salad of a raw grated beetroot, carrot, and swede. The lemon and oil dressing. It's a thing due to the beetroot, but it gets things going. Okay. Lemon essential oil, diluted in a tablespoon of fractionated coconut oil and applied to the abdomen. That can be helpful. So that's your essential oils. 1 to 2 tablespoons a daily of LSA. Jeepers, that stuff is great for constipation. LSA is ground linseed, sunflower seed, and almond. Just add it to salads, cereals, smoothies. Yeah. And if the condition is chronic, then do consult with a naturopath as well, and there's some homeopathic remedies. Cystitis or lower UTIs, urinary tract infections with UTIs, ability to cause uterine irritability. That can be potentially preterm labor, and recurrent UTI should not be treated lightly. You may need an obstetric consultation. Herbalism and nutrition, garlic, of course, a few doses of zinc, inner health, bladder support, health type supplements, increasing protein intake. And as I say, recurrent UTI should not be just seeing the obstetrician or midwife, but also seeing the naturopath or herbalist. And prophylactically, cranberry tablets can be useful. As a gate, look, there's other things, but I'm just giving you an overview. So some of the pathological complexities of pregnancy that can be well supported by perinatal integrative medicine. I'll just run through them down. Antenatal depression, hemorrhaging, it's vaginal bleeding, cholestasis, gestational diabetes, hyperemesis gravidarum. That's when you've got morning sickness. It's off the charts. Intrauterine growth restriction. That's babies that are not growing well. Malpresentation. So that's babies that are not head down. Oligohydramnios and polyhydramnios. That's when you've got a lot of water, or you've got above average amount of water or below average amount of water in the womb. Pre-eclampsic toxemia. So that's pregnancy, high blood pressure with complications. What else we got there? Oh, they both say preeclampsic toxemia. Oh, there's 2 lines here of the same thing. Never noticed that. Perinatal, so pregnancy-induced hypertension, placenta previa, so that's your low-lying placenta or vasoprevia. Post dates, so when the pregnancy is going into those, when people are threatening that, oh, you might need to be induced because you're post dates. Recurrent miscarriage. Small for gestational age babies, and threatened preterm labor. So with a threatened or recurrent miscarriages, although abdominal cramping in the first trimester and vaginal bleeding or spotting in the first trimester are not uncommon. They are never normal. Often women will say, oh, I'm having this spotting, is that normal? No, none of it's normal, but it is common. but anytime there's abdominal cramping or vaginal bleeding, especially that first trimester, it needs to be treated as if it's a threatened miscarriage. So in other words, that woman needs to stop what she's doing, go and lie down on the couch, like stop, put your feet out, bed rest, bed rest, bed rest, until there is no cramping, well after until there is no cramping, and well after until there is no spotting or bleeding. Yeah, and okay, so yeah, and then so yeah, with light cramps or light spotting, priority is rest, rest, rest until it stops, and then follow up ultrasound in the next day or so, just to check that fetal viability. But with excuse me, with strong abdominal pain, as in potentially needing morphine, or with very heavy hemorrhaging, potentially needing a blood transfusion, then those situations the woman should absolutely be presenting at emergency department. Within herbalism, in the situation of a threatened miscarriage, or more to the point, actually recurrent miscarriages particularly, this is where a consultation is just so important. And it's really, when a woman has had 2 or 3 miscarriages in a row, we are talking of subfertility here, that she's falling pregnant, but she's not staying pregnant. And, often when a woman becomes pregnant, it's from that point onwards, there is this misunderstanding that all the ball is in her court at that point within the couple's fertility, that he's done his bit, and that sperm is connected with that egg. So all right, whether she miscarriages there is all to do with her system, her body, and it's not actually true. We know that lack of sperm health, impacts miscarriage. Around the fertility, infertility, subfertility situations, generally speaking, you can say it's about 40% sperm related. It's about 40% woman's body related. It's about 10% both, and it's about 10% unknown. Yeah. So those men need to be doing their preconception healthcare too. So one miscarriage is on its own as a singular event is very, very common. In fact, 1/3 of pregnancies naturally miscarry. So, if you've had, sometimes I'll be talking with women who will say things like, but I've had 2 successful pregnancies. Why is this 3rd one miscarrying? Well, it's kind of statistically your turn. It's not pleasant for anybody, although actually for some women, sometimes miscarriage is a huge relief a woman is hoping for. So yeah, 1 in 3. In fact, it's around 70% of fertilized eggs never implant, and of that 30% that do, 1 in 3 naturally miscarries. So actually, it's only 20% of fertilized eggs that continue on as a successful pregnancy. And people say, oh, what, so 70% of fertilized eggs don't implant? Yeah, and that's what sometimes people will term as a chemical pregnancy, because it's occurring so early on. So, she may be, for example, a week overdue with her period, and she takes a pregnancy test, it's positive, and then a couple of weeks, then she has some abdominal cramping and a little bit of bleeding, and another week or so later, there's an ultrasound scan done, and there's nothing there. It's never happened. And so that would be that chemical pregnancy, which, you know, in the way back, well, not that far back, but before the system of having, you know, easy to use home pregnancy tests, that's when a woman wouldn't have even known she was pregnant. She might wonder, and she'll think, gosh, that was a bit of a heavy, bit of a late period. I wonder if I was pregnant. But these days, you know, because we've got access to knowing so quickly, women often will become very emotionally attached to that pregnancy very, very early on because they already know for sure. And that can be tough when they're miscarrying, tough emotionally. Gestational diabetes. So with a mother that has GDM, who is successfully maintaining her blood sugars in the normal range by diet alone, then her fetus is fundamentally unaffected by the GDM. But any complementary support to assist her to achieve this is potentially, you know, very valuable. But also, always a multidisciplinary approach can be best. So obviously she's seeing her midwife and or her obstetrician and pregnancy team as well, but really good idea to also have a consultation with a medical herbalist. As I say, that could be Western herbalism, Ayurvedic, Indian herbalism, traditional Chinese medicine, doesn't matter. A consultation with an acupuncturist. Often the medical herbalists can be acupuncturists as well. And, you know, consulting with a nutritionist to become really aware of the nil calorie and non-synthetic foods as well. For example, stevia, which is a wonderful natural sweetener that has zero impact on the glycemic index, and things like shirataki noodles. Shirataki is a mushroom, and yeah, their noodles have zero carbs. And there's also, you can often get other shirataki things like shirataki rice, shirataki pasta. Yeah, so you can have these kind of what feel like carbs, but they aren't really carbs. Yeah. Okay, pregnancy-induced hypertension, also known as gestational hypertension. So is diagnosed. A holistic multidiscipline approach is recommended, including particularly seeing a medical herbalist, acupuncturist, and classical homeopath. All of those can help, because the big thing you want to do with pregnancy-induced hypertension is stop it becoming pre-eclampsic toxemia. All right. Okay, and we shall carry on. So here we go, pre-eclampsic toxemia. Again, you know, hypertension with other dysfunctions. That's what it is. So it's high blood pressure along with protein in the urine, or low platelets, or abdominal renal function, or abnormal renal function, or abnormal liver function. And so you need that multi-discipline approach again. But there's some other things there that can be helpful. So your fetal intrauterine growth retardation, or growth restriction, it's really the two big things there, you know, decreasing stress and increasing rest for the woman, and increasing protein intake for the woman. Just massive. But again, you want to be doing a multidisciplinary approach of seeing not just the obstetrician and midwife, but also an acupuncturist preferably, and very much a medical herbalist. Hugely helpful in that situation. So labor and birth, remedies there where it can be, where PIM, perinatal integrated medicine, can help. So you've got sort of normal discomforts or whatnot of labor, and so things like anxious emotions, perhaps a bit of asthma coming in, Obviously the woman would still use her inhaler if she has one, but this is just helpful things as well. Cramps, leg cramps can get really common. To help her very much, to help her exhaustion, fear and shock, nausea and vomiting, and her contractions. Complex things where it can help, where obstetric management is the first thing that occurs, but these other things can come in with it after it, just helping it along to reduce what's going on. So a maternal collapse, hypertension, meconium stained liquor, postpartum hemorrhaging or a hypertonic uterus, pre-labor SROM, so spontaneous rupture of membranes, preterm labor, pyrexia, so fever, retained placenta, so retained products of conception, and post-birth urine retention. So all of those are particularly useful things. Was through okay, so birth prep. These would be my kind of gold standards if you want it like really simplified, but again, better for the woman to be seeing and consulting, so her regime is customized to her and her pregnancy and her body. But if that's not possible, then these would be my go-tos. And you want, as birth practitioners, you want your woman to get obsessed with ripening her cervix. That's the big thing. Ripen that cervix. Okay, so a naturopathic blend. One of my favorites is product is a Nature's Sunshine product called 5W, because 5W stands for 5 weeks, because you take it in the last 5 weeks of pregnancy, so 35 weeks onwards. On the packet, it will say, on the container, it will say 2 capsules 3 times a day. I actually have a different variation on how to do that. And I suggest from 35 to 37 weeks, 1 capsule 3 times a day, then 37 to 40 weeks, 2 capsules 3 times a day, and then 40 to 42 weeks, 3 capsules a day. If an induction is medically indicated that's likely to happen earlier, then I would be recommending the 2 capsules a day right from 35 weeks. So the second note is, after giving birth, any leftover capsules that the woman has, she just continues to take them into the postpartum period until she runs out, because they really help with the womb involution. Okay, because they're a womb tonic. And okay, also homeopathic blends of pre-birth, used just as per its directions on the packet, and also some sort of birth aid blend used during labor. So homeopathic blends, I've mentioned a brand there, Naturopharm, but all around the world there are various homeopathic companies that will always produce some sort of pre-labor blend and a during labor blend, and they're good. So whatever is available in your area. And then EPO, so evening primrose oil, increasing the daily dose from 37 weeks onwards. And so I would again say, 37 weeks, take 2 capsules a night. From 38 weeks, 2 capsules twice a day. For 40 weeks, 2 capsules 3 times a day. Again, it's all about softening that cervix, and also adding in a per vaginal dose, a 1 capsule at bedtime. So you just grab the capsule, poke it with something to give it a few holes, so it can sort of start to leak, seep out overnight, and the woman puts that as far up her vagina as she can reach, because at the top of the vagina is where the cervix is, and just let her cervix drown in lovely EPO while she sleeps. And then in the morning, usually when you do your first wee, the capsule tends to just fall out, or can be easily assisted out. Okay, the 5 Birth-Rite kit information must-haves, I would say. This is what everyone should have, every woman should have, is her homeopathic labour birth blend, her Bach's flower rescue remedy, some electrolyte rehydration powder drink sachets or sports rehydration drinks, not to be confused with energy drinks. No, these are rehydration drinks because they have electrolytes in them. So rather than just drinking water, these rehydration drinks I think are better. Because if the woman gets dehydrated, that will slow her cervical dilatation progress. Lavender essential oil, fantastic in that birthing room. Put it into a diffuser. You can't use candle heated diffusers in a birthing room because there's usually an oxygen tank there as well, or oxygen in the wall. But you can get electric ones and they're great. And a few drops of lavender in the pool water when she's laboring in water, and even it very well diluted and sprayed as a facial spritz. Oh, fabulous for women in labor. Just feels so good. And music, that's another big thing. One of the biggest vibe influences of a room. Turn down that lighting because women get photophobic when they're in labor, and turn up the sounds, allowing her to zone out and surrender into those labor contractions. Often women sort of will put together playlists, and then they can find it's what they think they want to listen to in labor of their own music is not what they want to, and then afterwards that particular album or whatnot is or playlist can be something that she no longer enjoys in the same way. So if you go onto Spotify and you look under the profile mark Kathy Fray, you'll see on 0.5 there is my own playlist there called Childbirth. It's really long. There's untold music in there, and I can't recommend that one enough, in that it's actually it's almost therapeutic to not know what is the next song coming. And if there's some track that the woman doesn't like, we'll just push the arrow forward, skip it, go to the next track. But it's in a very eclectic this playlist, and I can tell you, and the other thing that's really cool about it is that hundreds of women have had their labor listening to that music. So it comes with its own vibe. And I can tell you, I have never, ever had a woman in labor say, oh, I can't stand that track, but, skip to the next one. It's never happened. But they love it because they don't know what's next. And the next song is typically quite different from the last song. So that's another wonderful thing. Okay, so first stage of labor, there's a huge amount of remedies that I've put here for you, particularly homeopathy. That's where homeopathy just comes into its own. In fact, I wonder if I've got this. Okay, so this is oh, there we go. This is a birthing practice homeopathic kit. So, that's what it looks like. Ooh, right, there we go. So you can see what it looks like. It's all these little pillules. Homeopathy can come as drops or sprays or little tiny tablets called pillules. And that's one there. So this happens to be the Birth and Beyond, a homeopathic remedy kit put out by Intelligent Health. But so this is a godsend. This is what you want in your birthing bag as a birth practitioner. A woman yourself, no, you don't need this whole thing. But as a birth practitioner, you do. And there's a great so this gives you an idea. So, you know, when you've got all of those different cervix comments there. So, you know, a cervix, okay, yeah, you can read through it, but all the various different cervixes and all the various different things going on with the contractions. Homeopathy is incredibly useful and powerful and effective, and game-changing in labours often. So stage 2 of routine birth care, which is stage 2 of labor of childbirth, of course, is the pushing stage, and then there's some remedies there. And if we move on to routine cares, so for the 3rd stage of childbirth, which is the birthing of the placenta and the membranes, and then effective control of bleeding. So, you know, the birth is over not once the baby's born. The birth is over once the placenta and membranes are born and we have control of bleeding. Yeah. Okay. So postpartum hemorrhaging, yep, we've got, so there's various different herbs there. A prophylactic, a really good prophylactic homeopathic remedy is arnica. So yeah, that's a good one to have, particularly for a woman who may have a history of PPHs. And yeah, so I'd always give that to her, you know, to helpfully stop or reduce what might be coming up with the hemorrhage. So then during the hemorrhage, there's a whole lot of homeopathic remedies there, depending on particularly what's going on with that bleed. And then after the postpartum hemorrhage, PPH, a couple of them too. So when a woman has had a huge loss of body fluid, especially if she collapsed, then China is the go-to homeopathic remedy for her to be taking. And if she's just got, you know, a real exhaustion, then there's other ones there that we're mentioning. So perinatal integrative medicine for the postpartum maternal wellbeing healthcare settings. So these are the different things where where perinatal integrative medicine can really help. Lots of different common issues that go on in maternal well-being at that point. And again, I'm not trying to push it, but it's just it's factual. So a lot of detail, you know, the whole details of all of that, with, you know, pages and pages of lists of specifics, you'll find in the Oh Baby book. So really good, you know, thing to have. For women, I would say, you know, download your own e-copy and refer to it anytime. For birth practitioners, I'd say get yourself a hard copy and, you know, have it in your birthing bag or, you know, with you on birthing suite. Routine postpartum must-haves for most women, I would say, is you want homeopathic arnica, 4 to 6 doses a day during that first 48 hours. It really hugely assists with internal bruising, inflammation, and, you know, general recovery. High quality daily maternity multi, high quality omega DHA oil. So those are things that she was already taking antenatally. Hypercal, oh my god, it's so good. Hypercal, which is a combination of hypericum, which is a natural skin antiseptic, and calendula, which is a natural skin healing promoter. So hypercal, hypericum, calendula, hypercal, the combo, which comes as creams or gels, it comes in other formats, but that's how you want it in this situation, a cream or a gel. It's incredibly effective for skin healing. You know, so it doesn't matter what the broken skin is, whether it's a scar from a C-section, perineal suturing, sore nipples, it does not matter. Anything to do with skin healing, it's amazing. And so what I would say for as an idea of a guide of use for a woman who's got a few sutures or she's had an episiotomy, then what she wants to be doing is every time she goes to the toilet, every time she's sitting in the toilet, she's wiping that area, slather on some more Hypercal cream. So basically every time she go to the loo, use another opportunity. So half a dozen times a day, it is great. It's wonderful. And I can tell you honestly, hand on heart, which is, I remember telling this information once at lunch to an obstetrician friend of mine. We're out having lunch and she was blown away. But I can tell you, hand on heart, truth, I have never had a postpartum infection in a woman's perineum who's used Hypercal. Never. So it is amazing stuff. So that, everybody wants that. And usually, she'll never go through the whole tube, typically, in that postpartum period. And, a year later, when her little one is starting to walk and falls over and hurts its knee or something, get out the Hypercal. It's any broken skin, amazing. Okay, so also consider a chewable tablet of vitamin C and zinc, particularly if that was an instrumental or surgical delivery, so it's C-section or ventouse or forceps, and consider rosehip oil for scar healing, if it was a C-section episiotomy. And consider a 1 month supply of Siberian ginseng to assist combating the normal sleep deprivation of postpartum period, where there's a history of, particularly when there's a history of depressive disorder, of any kind of depressive disorder. So when you've got a woman who's got a history of having depression, either currently or previously, then a 1 month supply, well, actually in that case I'd say a 2 month Siberian ginseng, and the first month after having the baby taking Siberian ginseng. In fact, really she should be on it all the time, but it's amazing stuff. And I'll throw in there another one. If you've got a partner, a male partner, who is or female partner, but a partner to that woman who is so stressed. I've had situations where the woman, it's the postpartum, she's fine, she is tickety boo, mentally excellent place. Her partner, so stressed, so worried. It's like having the responsibility of this tiny little human being. Some women guide through it, and sometimes their partners don't. And a really good remedy for them I found is 5-HTP, and that's a wonderful serotonin booster that those guys can take at night. And it's really good. It just takes the edge off things, so they are a little bit less stressed or worrying about their newborn. Okay, we're almost coming to a close here. So lactation, so again, you've got a whole lot of different remedies there that you can screenshot, depending on what's going on. And breast engorgement, so that during the first week, that's normal. We expect the breast to engorge in that first week. It's a wonderful sign. We expect we expect the woman to basically be oversupplying her baby, because when we look at how much a baby drinks, I mean, in the first 24 hours, a baby drinks about 30 mils, like 2 tablespoons. That's it in 24 hours. But that same baby a month later is going to be drinking about 1 liter a day, and so the milk production for the breast has to the needs is going to drastically rapidly increase. So that's why often women will make a comment that they at around sort of 4 to 6 weeks after having a baby, they go, I feel like my supply has gone down. No, you haven't. Your baby's still making loads of wet nappies. Your supply is wonderful. But what's happened is the supply and demand have just evened themselves up. But anyway, okay. So breast milk undersupply. So the commonest cause of breast milk undersupply is just the woman not resting enough, doing too much. Yeah, so we've got a 24-hour milk supply boost fix there, which we can't recommend highly enough that she does, and then also some naturopathy and homeopathic supportive remedies. Nipple trauma, sore or cracked, nipples. Again, there's some naturopathy remedies and homeopathic remedies there. My all-time favorite winning combo to effectively treat sore nipples is when you've got a situation of very sore nipples or very traumatized nipples, is hypercal cream applied after every feed, and wearing hydrogel disc pads between feeds, and then those two together just they fix almost everything. And then obviously making sure that the baby's latch is efficient, and the baby is correctly latched. So yep, those two there. Oh, and people would say, oh, but is it safe for my baby if I've got hypercal on my nipples? Well, yeah, it's completely safe. But what you would want to do is just wipe it off before feeding from the point of view of slippage. So the baby gets a better grip onto your nipples. But yes, it's completely safe. In fact, I'll get to that. So perineal vulva wound healing. Yeah, so I've mentioned there that hypercal cream, hugely beneficial. Everyone should buy that before they give birth. Have it in the kit, not something that they do afterwards if they need it. You need it. If you need it, you need it then. Okay. So for the neonate, normal cares, for the transition into from intrauterine to extrauterine, to gently assist it. And when we're talking about when the baby is just born, it's great if the birth practitioner carries a routine blend tincture, where it's a mixture of 5 drops of aconite, 5 drops of carbo-veg, 5 drops of opium, and it's in a teaspoon of cold boiled water. So she has that blend already there in a bottle. It's all ready to go. And then she administers 2 drops of it to the newborn as soon as practical. 2 drops into its mouth. From a World Health Organization perspective, FYI, that using homeopathy on a baby does not change its fully or exclusive breastfeeding status. Okay. And homeopathy is just the most wonderful, gentle thing to be using on babies. It's so effective. And then there's an additional homeopathic birth remedy that we've listed there of other different things for babies, so for example, if their caput is really quite excessive molding, arnica, if there was some quite tight shoulders or dystocia maneuvers needing to be done, then arnica, or maybe arnica and hypericum. Yeah, so there's a few different things there that are real, and this is a few, but there's many more things that homeopathy can help with. And the neonatal well-being, in that first 6 weeks or so, these are things where, again, perinatal integrative medicine can be very helpful. So all of those issues are things that the PIM can really well support. And just an aside, just a plug for IMCO. If you who are not aware, there is a free PIM-friendly certification that you can do with IMCO. If you just go onto the IMCO website and go to the certification page, you'll see it there. It takes about an hour to complete. And then you will have the right to be able to display the PIM-friendly certification on your letterhead website, etc. Okay, so that is everything. And yeah, so I hope that was useful. I hope that was stop the sharing. Yeah, so hopefully that was useful and good for everybody today, and appreciate your time. And for those of you who are plugging in after the event, yeah, so we just want to wish you a wonderful rest of your day and rest of your week. And yeah, hopefully that was really useful. So bye everybody. Oh, we can't get out. We can't get out. Oh, hold on, we just got a cue there. Oh, thank you for the information. My pleasure, guys. So bye everybody.